Hi there, it's Dr. Tansavatdi. Tuesday, noontime, time for my little channel. We're going to talk about rhinoplasty, nose surgery. That's probably the surgery I do the most of and I really enjoy. And I find my patients are happy. I love what I'm doing, so you get the best of both worlds. So today I want to talk about recovering from rhinoplasty surgery and what are some of the expectations or what top things you should know about recovering from nose surgery. So a lot of people will know some of the typical things like bruising, swelling, but one of the most common questions I get is how long should I take off from work? How long does it take for the recovery process? And I'll say that what you need to know is that most often we put a cast on the nose. So that's a little splint that we put on the outside. Sometimes there's a splint on the inside. But pretty much close to 90% of the time there is a cast on the outside. So expect that that will be on for 1 week. Oftentimes I take that off at 1 week. If I did do a lot of breaking of the bones, it may help to put on another cast for an additional week. But oftentimes I do not use the cast another week. What happens usually is I put on more tape. So I've taken off the cast, you can take a look at everything, and I put additional tape on for 1 week or maybe 2 weeks after that. There's been studies that have shown that that really makes an effect on the healing process for the nose. So there, in terms of what you need to know for planning after surgery, I would say plan to have 1 week off from surgery so you're not walking around with a cast. Some people go back to work and I'm surprised, but they're fine going back with that cast on, and other people will wait a whole week before they go back after the cast is removed. After the cast is removed, you should have a little swelling on the nose. It will not look quite where it needs to be just yet. At 2 weeks, the swelling is primarily gone. About 50% of the swelling is gone, and you can walk around and people won't even notice that you've had anything done. You can go to the store, you can go visit your friends. You'll see some changes, of course, to your nose, but they won't notice that there's a lot of bruising or swelling. So that's when you're presentable, and I would give it 2 weeks before you're doing going out to see people. In terms of if you have a wedding or a big social function, I would plan for a longer period of time because you really do want to look your best for that. The other thing I get is people think it's going to be painful because it's, if you look at pictures on the internet, people have bruising around their eyes, they have raccoon eyes, they look like they just came out of a bar fight. That is typical for the first day or two. Some people don't get much bruising at all. If I have to break bones, expect that you're gonna have bruising in and above the eyelids and around the cheeks, so it looks like you have a shiner. So you're gonna be icing around the clock for a couple days after surgery, and know that most of that looks painful, but it's not painful. So most people will tell me it just feels sore if they touch it, but otherwise there's no pain. The part that is uncomfortable after surgery is the breathing. So you're gonna need to know that you're gonna be congested. We do recommend you take some heparin sprays, which are some nasal decongestants, and you can take that to help you breathe better. But the breathing will be off for at least a week. And then once we take the cast off and take out the splints inside the nose, your breathing is going to be a lot better after that first week. Are there comments? Okay. All right. And then, so one of the things that you might tell your bed partner, if you do have one, is that they need to be away from you. They can't be too close, because if their arm flails or whatever and hits your nose, that's a no-no that can disrupt the healing process. The other thing is that you may be mouth breathing at night because the nose is so congested. So you will be possibly snoring at night and waking up your bed partner. I don't use packing very often. If I do place anything, I might put a splint in, and that comes out in 1 week. So breathing will get better after that 1 week when I pull that out. Some people will tell me that the breathing is better right after surgery, especially if it's done for a deviated septum or if their nose has been broken in the past. So that's a plus. Bruising is normal, bruising around the eyes and cheeks. And I talked about that earlier. You may look like you came out of the boxing ring. And that goes away by that 1 week when the cast comes off. You can't wear glasses right directly on the nose. When the cast comes off, if it sits on the nose, it can kind of shift the bones. The bones are still healing. It can also cause some pain from that. So I usually tell people to not wear glasses directly on the nose. We have a way where we put some tape on the bridge of the glasses and tape it up to the head, or just avoid it completely, just wear contacts. So that's my recommendation for that. You won't be able to blow your nose for 2 weeks. A lot of people will feel congestion and want to blow their nose, but you can't blow your nose for those 2 weeks. You also have to learn to sneeze with your mouth open. I know that's a funny concept, but yes, you're going to be sneezing with your mouth open because you don't want to put too much pressure on the nose. And then you're going to avoid sniffing as well. One other thing that I will tell people, and sometimes it's hard for them to understand, is the tip of the nose is going to be numb. It's going to be numb after surgery. No matter whether I do an open approach or a close where I go from the inside, the tip of the nose is going to be numb, and it's going to feel funny. So when you go to touch it, it will feel like a rock. It will feel hard, it will feel firm, and it will also it won't feel like your own nose when you go to touch it. And the other thing that you might feel is the lip also, because we're working a lot on the bottom of the nose or the tip. If we're doing tip work, the lip's going to feel numb and also weird. It's going to have a weird sensation. So what do you mean? What do I mean by that? When you smile, you're not going to have the same smile. People describe that they look in the mirror, their smile's off. It's not going to be normal to smile or talk, but that slowly comes back. So I don't want to put that into your head that it's going to look strange for a while. It's only going to be for about a week to 2 weeks where you're going to feel like the upper lip is strange. Slightly bumping your nose will send zingers the first few times, and people get concerned. They'll call and they say, did I mess up my nose by hitting my nose? A slight bump is normal to get a little pain, but usually you haven't knocked anything off. Of course, you want to avoid a big hit to the nose. So avoid any contact sports, avoid anything that would put you in jeopardy of getting hit in the nose. That includes babies and pets. You cannot control your pets, and they will want to lick your face and hit you in the nose. So that's one other thing I would really warn patients out there. And last but not least, the last point finally got to the end here, that is about when you can expect all the swelling to go down and when you expect the final result. So I would say at about 6 weeks, you can expect a really good outcome, how your nose is going to look. But I would say about 80% of the swelling is gone at 6 weeks, and most people don't notice. Even your friends and family are going to be blown away. They'll be happy about the outcome. They can see everything that's happened to your nose. But the final result is at 1 year, and it will continue to change slowly at the tip of your nose. The rest of your nose will look just fine, but it's the tip of the nose that continues to narrow. If you've gotten some tip definition because the nose looks bulbous or round, that's where it takes about a year to fully see that effect. So there you have it. That's the top 10 things that you should know about recovering from rhinoplasty. I hope I've kind of encourage people to go and get a consultation, find out if they're candidate for a nose job. It really is much easier than you think. A lot of people have fears about taking that first step because it's an important area of your face, and it's a change. You're going to notice a change in your face, and they're afraid of what people might think. They're afraid of the recovery, and so there's a lot of anxiety around that. But don't be afraid. Come in for a consultation. Come talk to me, and I can answer a lot of the questions that you might have. If you do have questions about what I've said today, please leave a comment on Periscope or also on YouTube Live, as well as Twitter, my Twitter channel, Facebook, and all my other social media channels. Follow us at Faces by DRT. Tune in on Thursday, where I'm going to give you a preview our next topic for next Tuesday at noon. All right. Thank you very much. Bye-bye.